It gives us opportunity to bond with our children. Let's train them. Let's engage them to do some of the house chores. We can play indoor games with them. It's an opportunity for us to tell them Anansi stories which we have lost. Education is not just about a teacher standing in front of you. These are all things we want to engage our children. Let's have time with them and work with them. As parents, we want to also make time to exercise. If you don't have a hobby, this is an opportunity for us to look for one and activate it. This 2 weeks partial lockdown is telling us how retirement will be like. We must find things to stay active. Take an online course. Social distancing does not mean emotionally we should be distant. We can connect with people by using electronic means. We know the telcos have supported Ghana, giving us options, promotions, and others. Let's leverage on this. We may do our own pedicure and manicure at home. Washing our own cars at this time will save us, because likely one duster may be used to wash several cars, and that could also be a danger to the spread of coronavirus. We all as a family, we want to also prayerfully pray to our Almighty God Jehovah so that we can have the strength to stay calm and build our family up. In conclusion, those who are at home working, we want to tell you that you should still manage your time as though you are at the workplace. Avoid reading everything corona. Let's reduce the screen time. Let's avoid binge watching TV simply because children are at home. Indeed, we must say that all emergency situations in Ghana that may change the way people behave, the way people may do their things, may demand that we consider psychological assessment in the planning stage, designing, and implementation of interventions. What we need to conclude is that indeed we must reflect on all the good things that we have. Let's be positive. And Madam President urged me to mention that the media houses have done well, but we want to encourage you as professional psychologists to be positive. Look at the positive side of coronavirus. Let us avoid sensationalism. If people who do not encourage, who do not uplift, the people who don't believe corona even exists, we shouldn't entertain these ones on our media houses. We want to be mindful of the diction we use, especially if it is in the Twi language, talking about isolated ones, and we say yamantam womo. It connotes that we are equating ourselves to animals. These are things we want to avoid. In conclusion, we want to say that we should all remember that social distancing is indeed an appeal to our sense of discipline and love for one another. If we do not have anything that is highly unavoidable and emergency, we want to stay home. We have some helplines. In case you are still at home, you are afraid, you are still fretting, anxiety is setting in, you can call 020 000 9999. 020 000 9999, or the last one could also be 7. We wish you well, and our strength depends on keeping calm, connecting with one another, and all of us will be able to stay strong, robust, and resilient, and COVID-19 will soon be history.
Doc, thank you so much for sharing those notes with us from the Ghana Psychological Association. Doc, ewo Agyemang a omo na omo boa na sebe se obi mayem hihie ana se na dwendwen ya kompempenso bi a ye ni ho a omo so omo Dr. Agyemang ye na omo ne di nkomo boa no ma na kuma ne na dwen ne ade nyina begina baabi a epese e begina sabri a nipa ase nipa kuma etu isanse wo tese bi ese cases ne bi ka ho nanso ye kire se bi mo so ho tom yo a wo hwe bibi wo internet so hwe CNN nkeka ho ne ade no omodwuma ehu hia pa omo so ebo ye kokose sabre a woni nkwala ne ade wo fie no ma kwanya ma mo so mutumi ye ne ma bebre a eye mutumi ka mo humbom agro kakra mo bedi wo fie mpo wa bra ye twetwe ye ho enkomodi a titiro awofo ne nkwala ntanya kwan ndi sanse de bia ye kwa adwuma no ye nya kwanya say yeso betumi atena fie na yeso ye ne wonum nyina edi nkita ho san so the telephone numbers bia to dwa say simple say still be adwen ejina baby ama na kometu ana bibia otumi frɛ na mwa bi omo wonom de abo omo boa yen pa so wonom a ya test wo ma test positive pa na omo nyini ama yetumi ama omo dum pempen so bi a sese ehwoma so doc, we are grateful. We are almost at the end of today's brief and we'll take your questions shortly. I just want to update you on some legal matters. Now, the Constitution of the Republic gives all of us a number of liberties. But because of the current situation in which we are, we have had to take measures. Excellency, the President has had to take measures in the interest of the country to suspend some of our liberties and to impose restrictions. These suspensions and impositions had to be done in accordance with law. And so you will recall that right from his earlier broadcast, he mentioned that he was instructing some ministers to get either some legislations passed or some executive instruments issued and gazetted. We just want to give an update for the avoidance of doubt this morning. The declaration of public health emergency for COVID-19 pandemic, Executive Instrument 61, is currently in force. It was gazetted on the 23rd of March under the signature of the Minister for Health, the Honorable Agyemang, Member of Parliament, and it is pursuant to subsection 1 of Section 169 of Act 851. So the Public Health Act, Act 851, which gives them the power to declare a public health emergency, and based on that declaration, also now quarantine persons, which would ordinarily be against that person's liberties, is in force. And so we want to encourage for our colleagues, if it becomes necessary that you are asked to either self-isolate or to be put in a quarantine facility, there are laws that back it. Shortly, I'll show you some of the sanctions if we also do not comply. At this point in time, we're asking everybody to comply with authorities. But this is for the avoidance of doubt. EI 61 is now in force. It is what gives us the power to quarantine persons who have tested positive and also to restrict their liberties while we are supporting them with treatment. The President also asked for the enactment of an act known as the Imposition of Restrictions Act. As I'm sure you have followed, Parliament has enacted that. The President has gazetted that as well. It is that act that gives the broad framework for the imposition of further restrictions on the broader Ghanaian population. To do that, the President has had to issue two different executive instruments. EI 64, which was gazetted also on the 23rd of March 2020 under the signature of His Excellency the President Nana Addo Dankwa Akufo-Addo, and EI 65, which is the latest that imposes the restrictions on Greater Accra and Greater Kumasi, gazetted on the 30th of March under the signature of the President of the Republic, Nana Addo Dankwa Akufo-Addo. These two are available. We'll give you copies, colleagues, so that you can also, as part of education, make it available to the general public. Most importantly, there are sanctions for non-compliance, and we'd like to draw your attention to what some of those sanctions may be. The Ghana Police Service, leading the joint security operation, is under instructions that persons who do not comply with these restrictions don't have to be beaten or subjected to some inhumane treatment. They have to be
The message is simple. When you are arrested and found guilty,
My understanding is that that is the head of prosecutions of the Greater Accra Regional Police Command. I think it's Chief Superintendent Donko, and there are sanctions, as we have mentioned, and these sanctions will be applied if you are caught violating these restrictions that have been imposed. It is in our own interest, and so we kindly ask the entire population to comply. Shortly, we will take your questions and have an opportunity to respond to them, and acknowledge some of our colleagues who want to also contribute to the COVID-19 relief fund. So if there are questions, may I ask for the microphone to be set up as we prepare to take those questions. So please introduce yourself to us. Please introduce yourself to us and let's hear your question.
I'm Joseph Akabila. I work with JoyNews. My first question has to do with the PPE distribution. I just want to find out whether it includes the private sector in terms of the health facilities within that sector. If yes, how far have we gone? If no, why? The other issue has to do with how many test kits we have available, and I'm asking because we have for some days now been embarking on the enhanced testing. And finally, is there any specific plan beyond the imposed restrictions to ensure that the regions that have not recorded any case don't record cases? Because we have 5 regions now, just to ensure that we don't have it moving into many other regions. Thank you.
Thank you. Good morning. I'm Selom Amenya. I work with TV3. I want a little bit of clarification. I think when Dr. Bedu Sarkodie was speaking, the travelers under quarantine, he mentioned 89, and then the total he mentioned 214. I don't know. That's what he said. So if he can clarify that for us. And also, last time when we were here, people asked about transportation, and then you said Ayalolo was working. But as at yesterday, they packed their buses.
Yes.
So we want to know what government is doing, because we've seen situations where trotros have not observed the social distancing, and then passengers have been asked to get off, including essential workers. So we want to look at that. And also, government has put in place plans to take care of KIAs, but there are also concerns of others who do not fall under any group, maybe a truck pusher or something, who does not have a place to sleep. What are the plans?
Okay.
And when you go to our markets, social distancing is not being observed. So what is the strategy in terms of public education for those people also? Thank you.
Very well. There were 2 other hands. Yes, madam. Yes, sir. Star FM or GH1 TV? Yes, please come forward. So, Dr. Bedu Sarkodie, please be on standby. You help me clarify the numbers. Ghana Health Service, you also help me deal with the PPE question that came up. Yes, madam.
Good morning. My name is Hawa from City FM and City TV. Now, first of all, I would want to find out the issue to do with the PPE. Just last night, doctors at Kolebu, the emergency department, said that they don't have enough of those PPEs and are threatening to withdraw their services. Yeah. So what's up with that? And then secondly, one colleague mentioned the frontline health workers. You see them queued at bus terminals, waiting for chotros, which they are not getting, because there are instances where a car from Medina cannot go past Oponglo, and you have essential service providers in that bus. What is going to happen to those people? Thank you.
Thank you very much.
Thank you. My name is Joshua Nanakwame. I work with GH1 TV. First of all, I would like to have some clarification on the mode of communication with regard to the contact tracing and the mass testing. Because I was in Ayawaso West Municipal Assembly on Monday, Monday, and on Wednesday, and there was a challenge. The residents or community members we spoke to at some point, many appeared oblivious of this particular exercise, and so some were wondering, should they stay home, because those who have the pass to actually go work would have to leave the house, and those who are not aware, because of skepticism. They would have to close their gates or their doors to anybody who come in, regardless you have an identity or not. So how do you take care of this exercise? And secondly, I would also want to find out, we are hearing a lot of numbers, conflicting figures as to how many ventilators we need now. And how are we intending to procure them? Because the countries that we would want to get these ventilators from are equally grappling with the situation and trying to find some ways to manufacture same. So how are we actually going to get them?
Just clear up something for me. There are conflicting numbers on how many ventilators we need.
Yes.
Which numbers are these?
We are hearing that we need 1,000. We are hearing.
Who is saying this 1,000?
Yes. There was a report on air on our Accra-based radio station. We heard that they need 1,000. Some are also saying that we have
to be quite clear where we're getting these bits from, so that we don't confuse the public.
We're also hearing that we have currently at the moment we have about 61 altogether from the regional office. So just so, because we are also putting out information, so just so we get the accuracy, how much we have now, how many we have now, and how many we will need.
Very well. Let me just get into it. So Joshua's questions, I would invite Dr. Abuaji. How are we dealing with communication to support contact tracing in the local communities, especially with the example that he cites? And then maybe you'd have to go over the ventilator numbers for us, whether indeed there's a projection of how many we need and the numbers as we have them now. I think one thing I missed out is that to assist contact tracing, an executive instrument gazetted on the 23rd of March 2020 to establish an emergency communications systems and allow us to use some technology over the mobile phones to reach out to persons who we know fall within the primary databases that we are looking for, but who we are having difficulty in reaching out to, was also issued, and now it allows the contact tracing teams to use that technology to reach out to them. Dr. Abuaji, please join us and let's respond to these questions.
Okay, you can do that. Okay. I think I'll start with the PPEs in the private sector. Yes, as I mentioned, we've had engagement with the private sector. We've had challenges with PPE, not just as a country, as you know, it's a global challenge. In the initial stages, facilities have engaged private sector and shared, and we are hoping that they will continue as more come in. The challenge is that we have shortages everywhere. We're working, I'm sure when we ramp up the local production, everybody will be supported. We also, it's about also the essential workers. I can speak for health workers. We had encouraged all to come up with their ID cards, and for those who did not, who had lost their ID cards, we created an opportunity by the weekend for them to get their ID cards. We are asking and encouraging all facilities where they can arrange transport to pick people from the vantage points. We are engaging their associations, and met the midwives associations, and these things are ongoing to ensure that we find out solution to these ones. On the issue of ventilators, I think we need to be very careful. People are branding figures, all kinds of experts are branding figures everywhere. But it's a projection based on where you get to, how many bad cases you're going to get. And so, as we speak, we say we have, if you put all, both public and private, we can raise up to 200 ventilators. And I mentioned some of them. We have 307 ambulances that has ventilators, and in the event of challenge, we could access them and to use. We are putting the procurement of 50 additional ventilators. And as you are aware, even if you have money, it's not easy to get a ventilator these days. And 20 are in. And we are hoping that as the situation, as the forecast, we will continue to ensure that with time, production will be enhanced and we'll have access to more ventilators when they are needed. So our objective now is not waiting for the weather. That's why His Excellency has instituted such early measures to allow for early detection and containment, because nobody wants to get to the stage where you need 2,000, 3,000, 100,000 ventilators. That will not be there. So I think I've answered. Yeah, the communication of the contact tracing. From the beginning, we had mentioned that we're doing contacts of all those who are contacts. We'll come to their homes, and we'll do the periphery around the area where you are, but it's not compulsory. It's voluntary. where they could do tests to test for other possible community transmission. When you have a community that may have a lot of positives, that tends to be quite intensive, and you see a lot of tracing going on around your community. But we've not had similar problems in other places, and so it depends on how it is. And as we continue testing, as new tests become positive, there are contacts to be traced, and so the intensity depends on how many positives are in the area. But like we said, it is voluntary, but it's in our own interest to ensure that we get tested. There are people who are asking to be tested, and if they fall within the parameter, we test them. And that's how we have so far done about 6,000 tests so far.
Doc, answer our better, particularly Apomudi Agyemang reports maybe say to be a car or motive no say a sign car no near there who can be efa their moye or but you can be to make an tree am.
Let's say you can't show via or your health worker say omo dey answer look to ID card. I bet you say we a health worker, for example. Say be a bibi any I bet me isolate you free. And I say kuta ID card there. Be had anything na weekend on Saturday and Sunday, we get opportunity say wow ID card I there bra. Me enye bi ma. Na me engage me eje all hospital say wa obi oni ID card o munye system say ba bet na produce bi am say be a oduro baby I stop wa o bet me dey actually say me a health worker. And yes obi aso ya oh me a health worker na Agyemang na continue and I also share hospitals say mo am bet me arrange vehicles so mo nye na mo timu peke and go for Agyemang na mo for especially when me Agyemang na job.
And the PPEs, private sector included?
Yes, initially we have shortage. So definitely, like I said, everybody will any enough. Now, in the same minister, Agyemang didn't so be a buy the charm especially in Accra and parts of Kumasi.
Doc, thank you. Dr. Bedisa Akodie, please join us and let's clean up these numbers. I think I also just got notification that some number of 214 is running on some TV platforms. So if you can just clear it up for us. Where are we?
Thank you very much. For clarity, the case burden in Ghana, in total, all confirmed cases stand up to 204. And these are the distribution. Greater Accra, we have 183. Northern Region, 10. Ashanti Region, 9. Upper West Region, 1. And Eastern Region, who just joined the number of regions reporting cases, 1. The travelers, I mentioned 89 being a combination of the travelers in quarantine in Greater Accra here. There are 79 of them, and we have 10 in Tamale. If you add the two, we have 89. Thank you very much.
Thank you very much.
Yes, all these add up to the 204.
Okay.
Thank you very much.
So if there was a misspeak at some point, I think it's quite clear now for all of us to know. I am corrected also that the police representative who outlined the punishment for us is ACP Lydia Donko, head of legal and prosecution in the Greater Accra region. So she will prosecute you if you are found in breach of the law. Now, there are a few other questions. How many test kits do we have? I think, okay.
Thank you. I think I made that question. We currently have capacity for about 42,000 tests. But we're expecting more test kits this week, and that will ramp up our opportunity to test more.
Okay.
And looking at the tests we have done, we are expecting that by the end of the period, we would have done a lot of tests.
Thank you. Thank you.
And we have capacity in Kumasi, Accra, and 2 centers in Accra, Kumasi, and by the end of the week, additional centers will be added for testing.
You would recall that we mentioned that there are a number of other facilities that could simply recalibrate their systems to join KCCR and Kumasi. They are being brought on board. Already one is on board now. Again, you will recall that at our last briefing, the minister responsible for health informed us that as at that time, we had received a little over half of the about 50,000. We are now being told that we are hitting about 40,000 thereabout, yes. And we still expect some more. Why? Because we've decided to adopt a strategy that goes in search of the virus and not wait for people just to be reporting cases. And that's why we're using this enhanced testing approach. So thank you. Now, the clarification in numbers has been done. Ayalolo, yes, yesterday we were informed that Ayalolo had halted services predominantly for some financial reasons. There was a cabinet meeting in which the president instructed the minister responsible for transport and the minister responsible for finance to quickly get together and resolve whatever bottlenecks there may be there, for which reason Ayalolo suspended services yesterday. Because especially at this critical time when you're asking people to socially distance on transport, you must ensure that the state transport like Ayalolo is functioning. So yes, yesterday we are informed that they suspended services. The ministers for transport and finance have been asked to get together and quickly resolve that bottleneck for us. Is the social protection program for Kaya Ye only? No, it's for the homeless and the vulnerable. I think when the minister was here, she mentioned even the numbers of the Kaya Ye they were looking at, and the disabled and other categories as well. So it is not for Kaya Ye only, it is for the homeless and the vulnerable. The minister responsible for local government has been asked to work with MMDCEs in whose districts the restrictions have been imposed and the security agencies to ensure that social distancing takes place in the markets as well. We acknowledge that it is not being fully observed in the markets, and they have been asked to ensure that some more attention is paid to it. I want to take the next batch of questions. Yes, sir, your hand was up. The gentleman in the purple jacket. Yes, sir. And then I'll go to the platform to take some questions. There was a question we didn't answer about regions. Say again? The Kolebu doctors. I'll let them speak to it shortly. But there was another question about regions. We will deal with it in the next batch of questions. Yes, sir.
No, my name is Yapeko. I work with Africa TV. I'd like to speak in the local dialect.
Please do.
See, I already started on cases no was so come out senior crack. But you see, we him a copy other regions. You beat me, like I say, young consider our regions no so as lockdown. You beat me, like I say, I already copy other regions. You beat me, nationwide lockdown now. I feel so, you're feeling crossing also should be hand sanitizer society. I'm saying, some had you over. A bina she be in crossing him, I don't know, or moon teaming to be no. A bina she be so much in Abuama in crossing for in your hand sanitizer. Now, for social media, and since we possible, HSA, this vaccine be free among ever, vaccine. If free among ever, say. Ghana, the jet to Muna, and I won't go for my say a home since I'm so intimate now, clarifies us.
Yes, sir. Is there a vaccine coming? Is there a government program to put out sanitizers? Do we, or are we contemplating a national lockdown? And then the old question about avoiding spread to other regions. Yes, sir.
My name is Nana Asante from Adam TV. Honorable, the person besides Ghana has service. PPE is not much. Are they considering the security service or more year in the money over side more movie and
okay. Thank you. Okay, we're done with the questions in the auditorium, or yours will be the last, and then I'll quickly go to the platform so that we can wrap up.
But the friend someone TV Africa. But maybe my question is psychologist hospitals no. Oman no yenya psychologist now omo ho a omo omanya yare ni bi no yenya omo ho omo so ehwe omo na so omo no ekasa afi mo ko se mo ko test no mo ni psychologist ekoye ama you ina this psychologist say na matter get omo say mo do omo yes exercise na afi so me question back wo efa trotro ni anga me free hours never uduru can you see first lighter police for soldiers now no so ma kan enko akra inside no masi na so be na nti o kwan hin nti no so person ehu se trotro no ombe ye aduma na won ye aduma yes
okay what's some chat on you be fan say feedback near the team na coordinate the security side no na ometumi ehu senior sa process no be improve no. But bottom line is that public transport continues to run as an essential service. Public transport, including Trotro, was a course of the here and said Nipa better to I think these are the questions from the auditorium. So let me take questions from the platform and then we'll wrap it up very quickly.
So there are three questions. One, we want a situational update on the doctor at Lekma Hospital who tested positive to the virus. Claims are that he has been deserted and left to his fate. This notwithstanding, his family has been exposed. Any plans to test them? The second question is, I learned the 8 Guineans and 2 Burkinabes who tested positive for COVID-19 in Tamale have been rejected by their home countries. Can the minister give an update on the issue and the treatment being offered to them? And finally, government has allocated some 7 million cedis to trace contacts of infected persons. But for almost 3 days, we have been told one person who has tested positive is on the run and cannot be found. What is the challenge? Isn't the continuous disappearance of this one person undermining the work being done to limit the spread of the virus? Thank you.
Okay, so I'll just take a few, and then I would invite my colleagues to deal with the rest. Now, the person who escaped in Tamale and who the security agencies seek to locate is not somebody who will be located from contact tracing. Contact tracing is when we know there's a positive case and then we look for persons who have come into contact with that person and also have those persons engaged and tested. That one is a security operation. Indeed, an arrest was made yesterday in connection with that one. But the specific person, as of this morning, I don't have a brief, has been arrested. But it's an active operation that the security persons are very keen on, knowing the identity of such a person as well. A question about the 8+2, with a claim that they've been rejected by their home countries. I am not aware of that. What we are aware of is that the ministries of Interior and Foreign Affairs are working with their home countries or countries of residence to conclude the repatriation conversations and possibly repatriate them for treatment in their home countries. We have been required to substantiate or prove, just like if you recall, when we were having the tango with our friends from the US, when you want to repatriate somebody to another country, there needs to be a certain establishment that indeed he's either resident in that country or he's indeed a citizen. And that is a process that they are going through to complete that one as well. I'll leave the Lekma question for Dr. Abuaje. I'll leave the psychologist's question for the association. Ghana Health Service, do you have PPEs for security agencies? I'll leave that one too to you, Dr. Abuaje. Is it true there's a vaccine coming? The question of sanitizers, there is not a government program to distribute sanitizers to every citizen or everybody. No, there's no such program. But government is supporting various groups that are so doing, and a lot of private individuals are also doing so. Indeed, today, Maslock is here to make available some hand sanitizers, which will be donated and distributed to some groups. I'll let them speak to it shortly. But no, it is not a standard program to distribute sanitizers across. I know a lot of members of parliament are distributing sanitizers in their own constituencies. I've done mine. I know a lot more are also doing this. But no, it is not a government program to be doing. What government is doing a lot of public education so that people can also help us at the last mile. So, Dr. Abuaje, avoiding spread to other regions, vaccines, PPE for security agencies, LECMA. Finally, let me speak to this question of a potential national lockdown. We have always said that all cards are on the table. Currently, no such decision has been made. We do not have a reason or a basis to make that decision as at now. But as we have mentioned, as the President mentioned, all the measures that he's taken are in our interest. He continues to review them, and whatever needs to be done at any point in time will be done for the protection of the population. Dr. Abuaje, please come up to the microphone.
Yeah, thank you very much. On the question of the security and PPEs, yes, those involved have been given PPEs, and I'm sure when you see them in town, you see all of them wearing masks. That's PPE. The TV Africa person is also wearing a PPE. That's a mask. These masks are all PPEs, so they have been engaged. In terms of the other facilities, as part of the enhanced contact tracing, all the other regions were asked to also enhance their contact tracing and search. And that is why you found a lot of regions looking out for people who have just rushed in to find some assessment to see what they will do. So all of them are doing. That's why we have found a case in Eastern region, and that's why other places have also come up in this short time. So there is an enhanced lesson. When we are talking about contact tracing, my contact, I may believe in Accra, but my contact may be found in Tamale, and the system there will go after that person. So the contact tracing and surveillance is all across the country, in every place where we need to find somebody. LECMA is, we've been handling that, and I know my update from the regional director that a lot of has been done. Starter contact tracing has started. Those who have been exposed have been done. The system is not too different from anybody who is found positive. Being a health worker requires that we need to provide some additional support and counseling to ensure that other people don't get frightened to stop working. And so a lot is being done by the region and the facility. And I think further details can be given. I'm sure some of these stories started long ago, it's been abandoned, but there's been a lot of things have happened since then, and I believe that nobody has been abandoned to their fate. We had some exposure at Ridge, and they're also being taken care of in the same way as others are being taken care of. Vaccine. Ever since it started, many research centers are doing enhanced and fast-track approach to developing a vaccine. Ghana, like any other country, is ready and waiting for such an opportunity to take part. And so once there's an approved vaccine, Ghana will certainly be and this is a global program, so globally they want everybody to have access.
But is there an approved vaccine now?
No, there's no approved vaccine.
I think we need to be categorical with that.
Going on.
Very well, thank you. Yes, sir, Doc. The question about psychologists.
All right. I must say that indeed, before the people who were quarantined are tested, they go through engagement with a psychologist, and when the results also come out, they also get engaged by the psychologist. Even for those who may be discharged going home, there will be follow-ups. Social distancing requires that indeed face-to-face support be reduced, so it could even be done electronically. And most major hospitals, some private facilities also have psychologists. And the Ghana Psychological Association, with the support of Ghana Psychology Council, we are recruiting more people so that indeed, even across the regions, as and when people are getting overly anxious and all that, we'll be able to support all these ones.
Thank you, sir. Colleagues, we would have to wrap up our briefing today. And before we do, I have some very important announcements to make. Can I get the iPad, please? We acknowledge that while we keep talking of a national response program, there are specific persons who are the forefront of this program. They are the men and women who on a daily basis put their personal lives on the line to give effect to the national effort. His Excellency the President wants us to convey his appreciation to the frontline health workers who receive patients daily at health facilities nationwide, who do not even know the status of the next patient coming their way, but who step up to the call each day to serve. Especially those also who are managing our 204 cases, and those who have helped us to contact, trace, and take samples from about 6,000 people in the primary circle as of this morning. The President of the Republic and the people of Ghana are indebted to you. The frontline security persons who day and night also put themselves up to enforce the restrictions as have been imposed, especially the ones who also use the opportunity to help us educate the public. Your service especially Your firm, courteous service is appreciated. The President of the Republic and the people of Ghana thank you for your service. To you, our colleagues in the media, who from the very beginning have been instrumental in social mobilization and getting the millions of Ghanaians aware of the COVID-19 pandemic and how to prevent it, His Excellency the President and the people of Ghana are grateful to you. Yenase kese koma yenuanoma eye central juma aboama bodewuro manipa dodo ate COVID-19 ehu ensem na omoboa abom ho ban. Ye bambofo a anopa ene anajo ewia wo mugina ewiem ni nsuom ehwe senhye a yede aba no eye adwuma titiri wo mo a efa akwaniasa so edi tu nkofofo ede ye akyerɛkyerɛ omampani ni omani na adamwase ya doctor fo ne nurse fo a moboa ma yahwe nipa be ya hanu ni enan a sabre omanya yare bi wonoma a eboa ana aboa ma sabre nipa mpim nsia a yetumi edi omachi atwe omunsu a ye teste omoso ye da omase sana mo amo hospitals so a mo receive patients no mo nyina so ye da mo ase a eni kabia. As we wrap up, we have some donations to make this morning. We are privileged to have with us the Chief Executive of Maslock, Mr. Stephen Amwa. Please join us.
You've been watching our live coverage of the Ministry of Information's press briefing on Ghana's current coronavirus situation. We've heard from officials of the Ghana Health Service, also the Ghana Psychological Association, the Ministry of Sanitation and Water Resources, who's announced they are taking advantage of the lockdown to cleanse the silt gutters in lockdown areas. If you missed any parts of this briefing, don't worry, sit back. We've got Ernest Kojomenu on standby with News Desk. We'll bring you a wrap of everything that has happened. My name is Mama V. Oswabwaji. Handing over now to Ernest Kojomenu.